On this edition of Veterans Health Watch, we'll focus on innovative mental health programs designed to help veterans during their mental health recovery process.
We'll also talk with veterans who will share their stories about the benefits of these mental health programs.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your co-host, Kenya Griffin.
And I'm Andrea McCoy. Today's show is going to be very important to us. We'll focus on two innovative mental health services offered to our veterans by the VA Maryland Healthcare System.
Andrea, as you know, the VA Maryland Healthcare System has established the Recovery Center. It's a program designed to help current and future veterans access their mental health needs and maintain their mental health and well-being. And joining us today is Dr. Mary Lambert, a psychologist at the Perry Point VA Medical Center. Dr. Lambert, thank you so much for joining us.
Well, thank you for inviting me, Kenya.
So let's start with a definition or description of the Recovery Center program.
So yeah, the Recovery Center is a program at the Perry Point VA. We have been up and running for a little over 2 years. We opened our doors in January of 2011. Prior to that time, well, as you may know, veterans at Perry Point, many of them are residing on residential units or inpatient units, or we have a domiciliary, we have long-term care units, and then many veterans receive services as outpatients. Prior to the Recovery Center, veterans received services on their individual units or in their programs, and that was fine, but no one unit or program had all the resources they needed to really provide a broad range of treatments to veterans for all the different problems they might, bring. So what we did was we centralized our resources in one location and developed the Recovery Center. Veterans then from all the units as well as outpatients come to this one location and receive services there. We emphasize groups and classes that are designed to help veterans with their mental health care, to provide the highest quality mental health care with few, if any, restrictions.
Great.
Thank you. Dr. Lambert, you spoke about the mission of the Recovery Center. What approach do you use to help our veterans reach their personal goals?
So we liken ourselves to a community college. We have at any given time somewhere between 35 and 40 groups and classes occurring throughout the week. Veterans are able to come in and choose groups that match up with their own personal goals. We have a number of themes in the Recovery Center. So kind of, if I can use that word, one theme is mental health recovery. So groups designed to help folks deal with issues like anxiety, depression, anger, stress, help them understand about serious mental illnesses, if they have an illness like schizophrenia, bipolar disorder, or major depression, for example. Another theme has to do with helping veterans to function better in their day-to-day lives. So we have groups on smoking cessation, problem solving, relationships and dating. Another theme is groups that are designed for the whole person, so meditation, yoga, mindfulness. And then I guess a final area is we have a number of support groups. So, for example, there's a women veterans support group, other groups for veterans with chronic illnesses, veterans who have a history of suicide attempts. We have a new support group for OEF, OAF veterans. We have a way of giving veterans feedback about what their referring providers suggest. So the veteran might have some ideas about what he or she needs to help them recover and move on. Maybe their provider had other thoughts, so we're able to give them that feedback, and then they ultimately make the choice. It's a very recovery-oriented program, so we emphasize veterans having a choice and that they are the ones really in charge of their own recovery, and we're there to assist them.
Yeah, it sounds like the Recovery Center allows the veteran to really engage in his or her own treatment or recovery process.
Absolutely. And some veterans come in, maybe they just choose one group during the week. Others may choose multiple groups every day.
And so who's eligible to participate in the Recovery Center?
Well, any veteran. That's one of the things that's different about the Recovery Center. We operate pretty much without exclusion, so you don't have to have a particular diagnosis. You don't even have to have a mental health diagnosis at all. You have to be able to physically get into the Perry Point VA, because at this point we are only at the Perry Point location. Now the Baltimore VA is working on their own version of the Recovery Center, so hopefully by the end of this year that'll be up and running. The only restrictions, I should say, are really, I think, very practical ones designed to keep everybody safe, and that would be if somebody were to, come in actively under the influence of alcohol or drugs, or who may present as a danger to themselves or others, we would ask them to leave for that day. But I have to say that never happens. Mm-hmm.
You mentioned that the Recovery Center is located at the Perry Point VA. Right. So specifically, how does a veteran get into the program? Do they tell their provider, or?
Yes, we operate by consult primarily. So if a veteran could speak to their mental health provider, most of them should be aware of the Recovery Center. We also get consults, or we get referrals from primary care providers. Many of the doctors in the primary care clinic will refer veterans for like the smoking cessation group, for example, or anger management or stress management or sleep hygiene, for example.
Great. Well, can you tell us about some of the feedback that you've collected, or maybe data you've collected to show that this program is indeed effective with our veterans?
Well, a lot of the data we've collected has to do with attendance, who's coming and how many people are attending. What we know is that for the past 2 years, on average, we've had about 1,200 separate encounters. It means individual contacts with veterans per month. On average, about 130 or so veterans are attending at any given time. And we get about 55 consults per month. And so those consults are coming from residential units, inpatient units, the long-term care units, the outpatient mental health clinic, from primary care doctors, as I mentioned. So they come from a variety of sources. The next phase of our actual data collection will hopefully involve looking at effectiveness, but we have, I think, pretty good anecdotal evidence that veterans find the Recovery Center very helpful. Comments like, "I wish they had had this program when I got out of the service," or, "Thank goodness for these groups and classes." I once had a veteran tell me that this group saved my life, and he was talking about the support group for veterans who have a history of suicide attempts.
Great, good news, the progress.
That is, really. We also have joining us today U.S. Marine Corps veteran Ms. Tammy Fetter, who is participating in the Recovery Center. Thanks for joining us today, Tammy.
Sure, I'm glad to be here.
Can you tell us about your military experience?
Certainly. I went into the Marine Corps as a young lady without direction. I was gung-ho, come from a military family, and I went through Parris Island boot camp and ended up in 29 Palms, California for my school and my primary duty station.
And could you tell us what happened with you, or what was your life like after leaving the military, or since being in the military?
Well, I experienced a trauma shortly after I got to California, and it had a tremendous effect on my life. I ignored it at first and just went on with my day-to-day living. And eventually, over the course of years, I began to develop mental health issues. I struggled with financial problems. Just focusing on day-to-day responsibilities became more and more difficult. And eventually, I sought out help from the VA.
Tammy, how did you learn about the Recovery Center at the VA Maryland Healthcare System, and how has your participation in the program helped you to reach your goals, your personal goals?
I had been an inpatient at Perry Point, and I was taking classes and in groups when the Recovery Center was developed and put in place. I continued to go. The classes expanded, and it enabled me to examine myself and to finally open up and admit to what had happened to me. Thanks to especially Dr. Lambert, was really a major influence on teaching me how to calm down. Stress management, anxiety, meditation, mindfulness were the most important things that I learned to control myself and to affect, I guess, a calmness when I was in a panic situation. And that was probably 60% of my issue on a day-to-day basis, was just how to deal with the panic and the anxiety.
Tammy, what would you like to say to some of our veterans today who are watching, who has not yet sought help from the VA?
I would say find your DD-214 and go to your nearest VA. It's the best thing I ever did. It saved my life. It saved my life.
Well, Tammy, thank you so much for sharing your story. It's always good to hear a veteran, a real person's perspective on how these programs work. So Dr. Lambert, how can veterans learn more about the Recovery Center services?
Well, if they, again, would speak to their mental health provider, they can receive a consult, and we will get in touch with them and invite them into an orientation where we provide materials, we show them the schedule, we help them to develop some goals for themselves, and then assist them with making some choices. But they get to hear what we have to offer first before they make any decisions. Anything they choose is completely optional. If they make choices and they want to make changes, that's perfectly fine. We have an add drop process in place, so there's no negatives, there's no downside to choosing a particular group. You can always change it or add more or what have you.
Well, thank you again. Thank you, Dr.
welcome.
Lambert.
Thank you.
Thank you, Tammy,
You're welcome.
again for sharing your story and taking the time to talk about this new program. We're going to take a short break, but when we return, we'll have information about another VA mental health program to help veterans in the recovery process. So please stay tuned.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
On my last tour, I was a drill sergeant, training some soldiers, and had an unfortunate accident.
I really didn't think I was qualified because I didn't have a service-connected disability.
I researched because there had to be some answer somewhere. There had to be some place for combat veterans to go.
Did you know that the Department of Veterans Affairs has been recognized for offering the best medical care in the U.S.? Locally, the VA Maryland Healthcare System provides a full continuum of quality care to our nation's veterans, including medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care. With a dedicated, highly trained staff, the VA Maryland Healthcare System is committed to serving the needs of our nation's veterans at 8 locations throughout the state. The VA Maryland Healthcare System is always there to serve and honor America's veterans.
At the VA Maryland Healthcare System, we're proud of our investment in technology because it's an investment in our veterans.
I was really surprised. It was a modern clinic with doctors for excellent care.
There's a sense of just that camaraderie. You feel really comfortable, and it has been helpful for me.
I would highly recommend all veterans to at least come down here and talk with the patient representatives and see what they are entitled to.
If you or someone you know served in the armed forces, tell a vet to call 1-800-463-6295, extension 7324, to to inquire about enrolling in the VA Maryland healthcare system. It's free to inquire and easy to enroll, so call now.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Welcome back to Veterans Health Watch. Joining us for our second segment is Dr. Jason Peer, a psychologist and local recovery coordinator for the VA Maryland healthcare system, and Mr. Royal Riddick, a peer support specialist at the Baltimore VA Psychosocial Rehabilitation and Recovery Center. Thank you both for joining us.
Thanks for having us.
In our first segment, we talked about the Recovery Center designed to provide mental health and well-being awareness and support for our veterans. But we know there's another initiative at the VA Maryland healthcare system called the Peer-to-Peer program. So if you could tell us a little bit about that, Dr. Peer?
Sure. So peer support services grew out of mutual self-help and support groups. And it's a more formal role that an individual who has the lived experience of having a mental illness or a mental health problem or a substance abuse problem serves as like a role model or a coach, and they're part of a treatment team. This is a really valuable service for veterans who are coming into mental health treatment because they can see somebody who's sort of walked in their shoes, kind of come through hard times and made it to the other side, and somebody who's active and successful in their recovery. There's some good research evidence that this is an effective service for veterans, and that individuals who receive peer support services are more likely to be more active in their recovery and their mental health care. They may be more engaged in that. In addition to that, it's a valued service in the community as well. In fact, it's reimbursed now in 20 states. There's Medicaid reimbursement for peer support services. So it's
good to hear.
Yeah.
Dr. Peer, I assume that staff working in these peer support services need specialized training?
Well, right. In addition to having the lived experience, which is an education in of itself, they often, there's certification. Different states have certification. The VA has an agency that provides certification. In addition to that, they peer support specialists get ongoing supervision, and then continue, and also have a lot of continuing education opportunities. Royal, if you wanted to comment on training as well, or certification?
Yeah, certification is pretty standard. Most states cover the same thing. Most certification processes last about the same amount of time. They go over the basics of peer support and some specialty items that are used in recovery, like WRAP, which is the Wellness Recovery Action Plan. We talk also about ethics and boundaries and group facilitation and things like that.
Royal, how has your time spent in the military and your personal life experience prepared you for this role as a peer support specialist?
Oh, I'm a Marine Corps Vietnam vet, and I also have been diagnosed with 3 mental illnesses. PTSD, post-traumatic stress disorder, bipolar disorder, and general anxiety disorder. I've been in treatment for 20 years. I'm still in treatment. But over the years, I've been pretty successful in my treatment because not only have I been engaged with the VA, but I've been engaged with organizations in the community. So I've had a well-rounded recovery experience, and I get to share that with the vets that I work with.
This is a very unique program where individuals who have gone through the program are helping others do the same.
Right.
How are your fellow veterans receiving this type of support?
One thing I think that helps is, as part of the treatment team, I'm one person that can say, I really understand what you're going through. I've been inpatient, just like a lot of the veterans have been inpatient. I've shared a lot of the experiences they had. I've been a single parent. I've been homeless. I've had acute episodes. So I've shared a lot of the same experiences that they have, and I've overcome those experiences. And through my recovery, I can say at least what worked for me, and suggest that they explore what might work for them.
And Dr. Peer, what specific advantages do you see to the peer support program?
Well, I think there's several. I think one, it really can make us be more creative about how we deliver mental health services, and is also creative about how we reach veterans. I think it allows us to think about doing more things in the community as opposed to just in the hospital, where peer specialists can go and accompany veterans in the community. I also think it sort of challenges clinicians to be more to think about how they define recovery, and to maybe broaden their expectations for the potential for recovery, and also sometimes our assumptions about people with mental illness and their capabilities. And I think another really great advantage is it gives an opportunity for veterans to give back, and so many veterans are really eager to be able to help other veterans when get through some of the stuff they've been through.
We do hear that from veterans a lot. They always carry that heart for service,
Yeah.
even
Right,
after the military.
right.
Yeah.
Royal and Dr. Peer, can you discuss some of the misperceptions associated with the peer support program?
Sure. Well, I think sometimes there's concerns that peer specialists will, not respect other veterans' confidentiality or violate sort of boundaries, and that is a misperception, because actually part of the training that peer specialists get is really about their unique role and how to respect and maintain boundaries. And then as staff at the VA, they're under the same sort of requirements and regulations regarding HIPAA and confidentiality, and they're trained about that, and supervision is provided for about that. Have you encountered other misperceptions?
Yes, I think that another misperception is that peer specialists aren't professional. That a lot of people don't realize that peer specialists are certified and go through a certification process. And so there have been times when I guess they were looked at as just hired patients and not part of a professional staff, and that's a misconception even throughout with patients and staff.
So to both of you, if a veteran was interested in becoming a peer support specialist, what are the opportunities for him or her to do that?
Well, right now there's a lot in the VA. There's been an executive order to hire 800 peer specialists across the country before the end of the year. So there's a lot of hiring opportunities, which I think is good. I think the VA is recognizing this as a valuable service. And so they could look for local positions and postings. But I think beyond that, there's also opportunities to volunteer in those positions. And some community-based opportunities too. I don't know if you
Right, I started off as a volunteer. And there are a lot of opportunities to work with peers without being necessarily a certified peer specialist. Being a peer just means being someone that's had a shared experience. So even though I'm certified and I work professionally as a peer support specialist, there are a lot of organizations in the community that use peers to teach peers how to do different things and role model for other peers and help other peers. So there are a lot of opportunities not only to volunteer, but sometimes after volunteering, there are opportunities to learn how to train. And actually Maryland is coming up with its own certification process. And people that volunteer can use that volunteer time to work toward their certification when Maryland finally starts its new certification process.
I'm glad to hear that the VA is part of such a big program, an expansive program, I should say. So, Dr. Peer, how can veterans who maybe need the services of a peer support service, how can they learn more information or access the services?
Yeah, well, that's part of hiring so many peer specialists is the VA really wants to emphasize that being available to any veteran who's receiving mental health services, whether that would be through in a trauma specialty care or in the psychosocial rehabilitation recovery center, or for veterans who are on the inpatient units receiving care, that peer support is offered across the continuum of mental health services. So, the hope is eventually that people don't have to look for that's just going to be part of that. We're in the process of hiring more folks to do that, and there's also folks that are volunteering at the VA doing that as well.
So now, for a veteran who's currently in a mental health recovery situation, do they ask their primary care provider or the treatment team about peer support?
If they made a specific request to the treatment team, then that treatment team could work with them to be able to access that. Yeah.
Great.
Royal, is there a website or a number our veterans can call to learn more about this if they were interested in joining?
Yes, there is an organization called the International Association of Peer Specialists, and they have a website. They can look that up, and it's the only organization like that in this country. And there's also an organization that's called NAMI, which is the National Alliance on Mental Illness, and they have peer programs not only for people with mental illnesses, but for people who have family members with mental illnesses.
And Dr. Peer, you touched on this a little when you talked about expanding the hiring process and hiring more veterans to be peer support specialists. But does the VA Maryland healthcare system have additional plans to expand this new program?
Sure. I mean, it's going to continue to expand, and I think also work to support those folks that get hired in those roles to make it a valuable and successful program.
Dr. Peer and Royal, thank you so much for joining us and sharing this valuable information about the peer support program. We've learned a lot, and I'm sure our viewing audience has too. So thanks again.
Okay. Thank you.
That wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or you can visit us on the web at maryland.va.gov. Follow us on Facebook and Twitter. We look forward to hearing from you.
If you are a veteran or know a veteran who is not yet enrolled for VA healthcare, please call our Enrollment Center at 1-800-463-6295, extension 7324, or visit your local VA, or visit us online. Please join us next time. Thank you.
The VA Maryland healthcare system is the overall healthcare system for veterans in the state of Maryland.
We have 3 inpatient locations as well as 6 community-based outpatient clinics.
The treatment that I've received from the Maryland VA healthcare system, it's been top-notch, definitely cutting edge.
I think what makes the VA innovative is constantly exploring new ways to become more efficient and more effective. We were the first hospital in the world to make the transition from film-based radiology to filmless radiology.
We measure everything we do. We are always keeping track of our ability to deliver the standard of medical care to all our patients. We have the most committed, diverse, and caring group of professionals.
You know, a lot of us have served in the services. These guys and these ladies, I mean, they're everything to us. And there's nothing I would not do for them.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.